है दोस्तों, आप लोगों ने तो कुछ लोगों ने चेकलिस्ट मांगा था एग्जाम में क्या क्या चीज़ें रिक्वायर्ड है उसके लिए। हियर योर चेकलिस्ट फॉर द DNB मेडिसिन प्रैक्टिकल एग्जाम. We are going to see each and everything which you are required to carry during the exam. Hi, I am Dosier, your friend or companion during exam. After the exam, you should read the checklist manifesto book by Dr. Atul Gawande. फिलहाल के लिए let's see our checklist. First thing you'll require is your apron, which should be clean and ironed. Then you require a stethoscope, preferably with the bell. They may ask you in a serious case, they may ask you to auscultate MDM, which is present in mitral stenosis, which is best heard with the bell of the stethoscope. Then you require to carry your stationery watch, preferably with the second needle. Then you are required to carry most important thing, which is your DNB practical hall ticket, which comes within a week of your practical scheduled practical date. Theory and practical both have a different hall ticket, so you'll have to carry your DNB practical hall ticket and paste your photo on it. Then the next thing is next major chunk of your kit, the kit box which you will be taking is a CNS kit. First you'll have to have your reflex hammer. You'll have to know the type of hammers which are used in clinical examination. This is Taylor's, Queen's and Traumer's hammer. Best Babinski reflex is demonstrated by which tool? That is Bentley's car key. Then your CNS kit, you require some things for sensory examination, which are pins, keys, tuning fork 120 Hz and 512 Hz. 120 Hz is used for vibrations and 512 is used for hearing. Then you require divider, cotton and hot and cold water for thermal sensation examination. Then things which you require for cranial nerve examination, you will have to have four small boxes which should be labeled with sweet, sour, bitter and salty substance. You'll have to have a card, small cards which will on which you have to write sweet, sour, bitter and salt. And while examining for the olfactory nerve, you'll have to hold the tongue of the patient. You apply the sweet solution or a salty solution, and patient has to tell which substance you have applied to the tongue by pointing at the card. So you'll have to have 4 cards. Then for optic and ophthalmic examination, you require Snehal charts, Ishihara chart. You'll require a torch, ophthalmoscope for the fundus examination, and then you'll require tongue depressor and throat substick for gag reflex. This is Snehal chart. This is Ishihara chart. This is your torch which you will be taking. Make sure it's a pencil torch. And this is your direct ophthalmoscope. This is your tongue depressor and this is your tuning fork. This is your divider. Then swab stick, you should have your mask on, and these are containers. Then CVS+RS kit. CVS+RS kit does not require major things. You'll have to have a 2 scale for JVP examination. You will require a cardboard for anterior, posterior and for checking the anterior posterior diameter of thorax. And you'll have you should have a measuring tape which will be for your abdominal girth, chest girth examination. Remember, by failing to prepare, you are preparing to fail. So before going to the exam, cross your checklist. All the best for your exam. Like, share, subscribe and comment what else do you want to know about the exam. Thank you. Bye bye.